ABC 10 News presents Live Well San Diego. Be healthy, feel safe, and thrive in your community.
Did you know that nearly 1 in 3 adults in the U.S. has hypertension? And now with the presence of COVID-19, managing high blood pressure and heart disease more important than ever. Joining me today, Dr. Christine Thorne with UCSD to talk about this growing concern. And Dr. Thorne, we talk about knowing your numbers. Why is that so important, especially in this time of COVID?
Well, unfortunately, high blood pressure is the #1 underlying condition in San Diego County associated COVID deaths. So knowing our numbers is essential. High blood pressure rarely causes symptoms. Measuring our blood pressure and managing our condition is the only way that we can help to prevent problems associated with high blood pressure.
What are some of the things that we can do to improve our health?
We can all do simple things to improve our health. Engaging in exercise every day, such as a brisk walk or even a jog, can really help to lower our blood pressure 5 to 9 points.
And no doubt what we're eating, what we're drinking and putting in our bodies makes a big difference.
We know that people have increased their alcohol intake during COVID, and this is one key way that we can actually increase our blood pressure. Alternately, if we cut back on alcohol and meet recommended guidelines, we can lower our blood pressure significantly. Engaging in a healthy diet focused on fruits and vegetables and low in salt can also lower our blood pressure even a couple of points within 2 weeks.
Doctor, great advice. Makes me want to exercise today. Thank you for your time. ABC 10 News supports community concerns like healthy living. On February 14th, get your blood pressure checked for free. More information, go to 10news.com.